Today we presented data of a phase 3 trial which we generated over the last 7 years. It's a randomized phase 3 trial for newly diagnosed multiple myeloma patients. Patients eligible for transplant were randomized to either transplant or the non-transplant arm. Patients in the non-transplant arm received 8 cycles of lenalidomide and dexamethasone, followed by maintenance. Patients on the transplant arm received 4 cycles of lenalidomide, dexamethasone, followed by transplant. So both arms, after completion of either 8 cycles or 4 plus transplant, went on to maintenance for 2 years with lenalidomide 10 or 15 milligrams. So our findings showed that there was no statistical difference in the overall survival and the progression-free survival of the patients randomized to transplant or non-transplant. Also in terms of response, we did not see any significant difference in the response rates. So the complete remission response rate was in about 23% in both arms. Also the 4-year overall survival was around 80% in both arms, and the progression-free survival around 50% in both arms. Those data I think are very important and show that the final role of transplant in multiple myeloma has not been identified. So it's very important to wait for larger trials like the Dana-Farber IFM trial, who might determine the role of transplant in multiple myeloma.